Good evening. My name is Dr. David Doman, and welcome to the 11th anniversary edition of Housecall. What's new with dental implants? Find out more right now. My guest this evening is Dr. Israel Puterman, a noted periodontist practicing right here in Montgomery County. Israel, welcome to Housecall.
Thank you, David. Pleasure to be here.
Our pleasure. Briefly tell our viewers, what exactly is a periodontist?
So periodontist is one of the specialties of dentistry, and we focus on the gums and the bone around teeth, as well as replacing teeth with dental implants.
What sort of training do you get? Does it start off with standard dentistry and then you go from there? How does that work?
Exactly. So everybody goes through 4 years of dental school, and then afterwards, if you want to become a specialist, you can do a residency program where they range in time from 2 years to 6 years, and periodontist is 3-year specialty program in addition to the 4 years of dental school.
Wow. So let's go on to the topic at hand. What exactly is a dental implant?
Dental implant is just a screw, and it's a screw that's placed in bone to replace the root of a tooth if a tooth has been lost or is failing and has to be removed. Then the way to replace it is by putting an implant, which is the screw, into the bone that'll eventually support the tooth.
How interesting. How long has this been around?
So the first implant was actually placed by a physician in 1965 per Ingvar Brännmark out of Sweden. And he was doing research on titanium in rabbits and noted that it was really tough to remove. And he found that titanium and bone really like each other. And his idea was actually to use this for dental implants. And the first patient was in 1965, and it was presented to the world in the early 80s.
How successful are dental implants?
Thankfully, very successful. They have approximately a 90, depending on the study that you're looking at, about a 90-95% success rate over a long-term period. So it's not an immediate 90-95%, it's a 90-95% success over a 15-year period.
That's impressive. So our viewers are wondering, what sort of patients would be appropriate candidates for a dental implant?
Really anybody. Anybody who's of age to be able to receive an implant, and that's pretty much anybody who's done growing. And if you lose a tooth, if somebody's congenitally missing a tooth, meaning a tooth has never come in, it never grew, then they're candidate for implants. And there's no age limit. The oldest patient that I placed an implant into is 99 years old, and the youngest is early 20s.
Now, share with our viewers the difference between a implanted bridge, a crown, and dental implants.
Okay, good question. Well, a crown means that the tooth is still there. So the roots are there and something has happened to the white part of the tooth. It's either broken or decayed enough that it needs support by putting a crown to replace the enamel parts. A bridge is if the tooth has to be removed, then you have to drill down the 2 adjacent teeth and make a 3-unit piece or more to be able to replace that missing tooth in the middle. That's a bridge. An implant, the benefit of implants is that it doesn't touch the adjacent teeth. It only deals with the one missing tooth. And so you don't have to touch the adjacent teeth. They remain as they are, healthy, and the implant just replaces that one tooth.
Generally speaking, are dental implants more durable than a bridge work?
Yes, the data shows that implants do last longer than bridges. Bridges are a little bit tougher to clean, and I don't know if you've heard, but not many people love to floss. And flossing around a bridge is a little bit tougher to do than even around natural teeth. And so when people don't floss, food gets stuck underneath, and you can develop cavities on those adjacent teeth. And so bridges tend not to last as long as implants.
Do you ever run into a patient, the rare patient, where you say, you know, I think maybe putting in a bridge would be better for you than a dental implant?
Sure. Yeah, typically very medically compromised people who you want to do the most minimal work necessary. A bridge can be done quicker, for sure. If the tooth is already out, it's not involving any surgery. So if somebody's very medically compromised or they're taking certain medications that maybe don't allow for an implant, or they need major reconstructive bone work in order to receive an implant, then a bridge can be a viable option, absolutely.
Can an implant be done if somebody has bone loss in their jaw?
So the majority of people who need implants tend to need some bone augmentation, some increased amount of bone. And the reason being is that when a tooth is lost, the bone around it that was there to support it shrinks. So there are very few people who had an implant or had a tooth taken out, need an implant, and have enough bone. So all day, every day, I grow bone by grafting bone, and in order to have the patient get an implant. It's an everyday thing.
And what if somebody has coexistent osteoporosis?
Yeah, a lot of people have osteoporosis, no question about it. We are lucky in that there actually is no link between osteoporosis and lack of ability to get an implant. So there's no increased failure rate of implants associated with osteoporosis. That being said, a lot of people who have osteoporosis take certain medications that make implants or any bone work of the jaw a little bit more complicated. And we tend to be a little bit more conservative with that for specific medications.
Why is it more complicated?
Because some of the medications really alter how our bone heals. And when we're working on bone, in order for bone to build, we actually need the bone to destruct a little bit and rebuild itself. And a lot of those medications alter the ability of the bone to reconstruct and destruct.
My recollection is that some of these bisphosphonates, the category of drug, could actually cause mandibular problems. Can you explain that to the audience?
Yeah, they definitely can. So bisphosphonates are the types of medications that alter the bone's ability to heal properly. Mm-hmm. And there's no question about it. It stops the destruction of bone, and that's why it leads to fewer fractures, hip fractures or otherwise. But in order to have bone heal properly, it has to resorb and rebuild concurrently. And if you're altering the resorption process, it makes that whole healing cycle a little wacky.
So if you have a patient with osteoporosis and is on a bisphosphonate, do you tell them to stop that medication for a certain period before you intercede?
It depends on the medication. Some medications are very, very low risk, and other medications are moderate, and some medications are don't touch this patient while they're taking this medication.
All right. So let's say Fosamax, a very popular one.
Yeah.
What would you do there?
Really no change at all.
Okay.
Fosamax is thankfully extremely low risk, and it really doesn't require any altering of treatment from our end.
What if somebody's on an annual infusion with Reclast? What do you do then?
Yeah, that can be a little bit different. It depends on how many times they've taken it, how long they've been on it, how far away they are from their last Reclast. And there are some things to take care of. A lot of people nowadays are on Prolia, which is 6 months and 6 months injection. And that's one where we would wait about 5 months from the last injection, and then we have a period of time where it's generally considered safe to go about it, and then they can take the next injection.
So let's have you talk the audience through what exactly is involved with a procedure in your office, your assessment, and then how many visits are required for the subsequent therapy.
Sure. Well, it really depends on what's needed for an implant. Let's say if somebody's coming in and they've already lost the tooth many years ago and they say, geez, I miss having that tooth, I wish I could chew more, then they would come in for the consultation and obviously do an exam in their mouth to see what things look like. We would take a CT scan, and it's a low radiation CT scan called a cone beam CT scan, and we take that in order to evaluate how much bone there is. And assuming there is enough bone, we can go ahead and schedule the implant. An implant is a 20 to 30 minute procedure, and that can be done under local anesthesia. If somebody has some anxiety and needs IV sedation, that can be done under some sedation. And typically a couple of sutures, so a couple of stitches, and they're typically resorbable. See a patient for follow-up, and then make sure the implant is good after about 2 months. And then once it's good, then I'm a surgical specialist, so I would send the patient back to their general dentist or their prosthodontist, and that restorative doctor, he's the one or she's the one who makes the tooth.
So the whole process will take, between multiple visits, several months to complete.
It takes several visits. It would only take one surgical procedure in that instance, and then making the tooth with their dentist. But that period of time would be about 3 months. Okay. So not a whole long time. I tend to joke with patients who complain about the long time is that we're growing body parts. Yeah. And it takes time to grow body parts.
Sure. Now, of course, many viewers will wonder, will my dental insurance cover this? What has been your experience?
So dental insurance is really a challenging discussion, because people tend to think of dental insurance the way they think of medical insurance, or car insurance or home insurance, where those insurances, they tend to pay for the patient, me, you, we pay for our oil change, we pay for gas. When we get into an accident, bigger stuff, that's when insurance company kicks in. Dental insurance is actually the opposite. Dental insurance tends to pay for the smaller things, cleanings, fillings, root canal, crown, and anything bigger, more surgical, higher cost, dental insurance backs away. So they tend to cover very little of dental implants and bone grafting, whereas they will cover more of the restorative side, meaning once the dentist making the tooth, the dental insurance will tend to cover a lot more of that side. They just tend to cover very little of my side of things, of the surgical side.
Well, if it's not covered, may I ask, what is the average cost then?
Oh boy, good question. What is the average car cost? It's a really wide range, and it really depends on what the patient needs and what type of implant. There are many types of implants. It depends on the training of the clinician. It depends on many different factors. And I don't know if it's possible to really nail down of what an implant itself costs, but it does cost several $1,000s for sure.
Okay. We're going to pause briefly for a public service announcement. More with my guest, Dr. Israel Puterman, and we'll be discussing dental implants. We'll be right back.
Hi, I'm Ryan Blaney, a third-generation race car driver, and we dedicate a lot of our time to going as fast as possible. My grandpa Lou is the reason why my dad and I started racing, and I'm really proud to follow in his tracks. But when my grandpa was diagnosed with Alzheimer's, it was a very unexpected bump in the road for us. I've learned a lot on this journey with my grandpa Lou, and the memories of my grandpa will always be with me. And in our family, we're used to getting involved, and I encourage you to do the same, especially when it comes to caring for your loved ones. When I think about Alzheimer's and the impact it had on my family, I recognize that losing a race isn't such a bad day after all. It's important to notice if older family members are acting differently, experiencing problems with their memory, or having trouble with routine tasks. Talking about Alzheimer's can be really tough, but if you notice something, have a conversation with your loved one. Encourage them to see a doctor or offer to go with them. Early detection of Alzheimer's can give your family time to explore support services, make a plan for the future, and access available treatments. If you or your family are noticing changes, it could be Alzheimer's. Talk about seeing a doctor together.
We're back. My guest this evening is Dr. Israel Puterman, a periodontist practicing in Chevy Chase, and we're discussing dental implants. Israel, when we paused for the break, one question many viewers, I'm sure, had was, what is the recovery time after getting an implant? What can they expect?
So simply getting an implant we're lucky in that the recovery is very minimal. Typically, people take ibuprofen or Tylenol for a couple of days, and that's really it. It's something that people are generally very surprised at, that there was very little recovery, very little discomfort, very little swelling, and we're lucky about that. Obviously, there are other procedures that are done in relation to it, bone grafting and gum grafting and so on, that can lead to a little bit longer recovery time. But it's generally within a week or so, most discomfort is gone.
And what do you tell the patient after an implant in terms of their post-operative instructions?
It's really just about staying away from the area. I'm always jealous of orthopedic surgeons or another surgeon who they could put a bandage on the leg and say, don't touch this, don't look at it, and no one's opening the bandage to look at it and play with the stitches. Imagine having stitches in your mouth and the surgical site we can't put a bandage on. And so everybody plays with the area and looks at it, and that's the number one thing that I tell them. Ignore it.
Yes.
Don't look at it, don't play with it. Generally speaking, tissue looks ugly before it looks better as it heals, and it'll mess with the mind in addition to messing with the actual area.
Sure.
And so it really is just typically soft foods for 2 weeks, and that includes things like noodles and fish, and it does not have to be a liquid diet by any stretch. And chew on the other side, and don't peek at the area. And that's really it for a couple of weeks.
So I'm sure you're very meticulous in what you do. What makes an implant look right versus one that looks like it stands out?
Yeah, so that's something that a lot of people will ask about, especially when they're going to be losing a tooth in the front of the mouth, upper front tooth that stands out when you smile, and everyone wants it to look right. And everyone knows that one person at a party who laughs, and you're kind of looking at their tooth and saying, God, something's not really right with that tooth, though they can't pinpoint what it is. And it's really about setting the stage for the tooth. It's if you imagine a picture on the wall, you can have the picture, that's the tooth, but the frame really sets that picture. And the frame comes down to the gum tissue and the bone surrounding an implant. And so somebody may not notice a small gum discrepancy in the back of the mouth, and so we don't really have to pay too much attention to it as long as it's healthy and functional and not bothering somebody. But in the front of the mouth, that's when we take another step up and really do absolutely everything we can with the gum tissue, making sure there's no little issue that makes something stand out. And so that's why sometimes people will need gum grafting in relation to implants.
When do you decide that somebody needs gum grafting before you complete the procedure?
So typically during the consultation, there's certain things that I look for, and I feel like it's my duty to really note these things right at the beginning of, hey, these are the potential red flags that I have in order to give you the result that you're looking for. And that really becomes a conversation of what are you looking for? Everybody's looking for different things, and some people might not show much when they smile and not really care how the gum tissue looks. And other people, when they smile, you see all the gum tissue, and they say, I really care about how the gum tissue looks.
Sure.
So it's really about what the patient wants, and we have that conversation right at the beginning, and we can recognize those things ahead of time.
One of the unfortunate results of the COVID-19 pandemic, as you know, is many people delayed or ignored their dental care. And now things are coming home to roost, and you have more and more patients showing up at their general dentist with multiple areas that need to be addressed. When do you, as a dentist, decide that all the teeth are candidates for implants?
Great question, and you're 100% accurate with that. As soon as the pandemic was over, and I mean the quarantine pandemic, the first 3 or 4 months was over, every dentist all over the country, all over the world, I imagine, was completely swamped with people trying to get in as we're trying to limit the number of people coming in. And so it was a really complicated time to practice. But there's no question about it, we all saw many more fractured teeth, broken teeth, decayed teeth. People tend to put off dental care, and if they were planning to do it in, say, spring of 2020, then all of a sudden that got pushed over in several months, maybe even years. And you're right, there were a lot of people who were sort of borderline beforehand that teetered into the zone of, okay, whereas it was borderline before, it's no longer borderline. Now you're way past the point where tooth can't be saved, or as you said, all the teeth, maybe in one jaw or even both jaws, can't be saved. And when we determine when that point is, it's really about the predictability of treatment. And the way I like to speak to patients is, hey, if we tried to save this tooth or these teeth and it didn't work, and in 5 years' time told you that this tooth or teeth had to be removed and replaced with implants, how would you feel? And some people would say, great, I got 5 years out of it, I'm happy. And other people would say, only 5 years? No chance, I want the implant now. And so again, it comes down to what the patient wants. And obviously if I tell them, hey, there's a 5% chance that this can work, then I'm assuming that leads them into the zone of the implant. But it's not always quite that divergent.
Sure. So if somebody comes in and their general dentist says, man, this is a mess, you need to have all your teeth addressed, how do you then decide you're going to do this sequentially? Mm-hmm. Or in other cases, you hear on the radio advertisements for centers where they do a complete mouth dental implant procedure?
Again, great question. So at that point, it really becomes, what does the patient have available? What type of lifestyle they have, what type of bone they have, what type of smile they have. And so if we're looking at knowing that all of the teeth, let's say in an upper jaw, have to come out, and should we do that sequentially or all in one day, like the ads that you've seen, then it's really about what type of teeth they want in the ends, what type of bone they have available. If the bone is really good quality, if there's a lot of bone, then we can, and I do this frequently, take out the teeth, put several implants in a row, and put teeth immediately on these implants, all in one day, in 3 hours or so. Yeah. And that's something that's very, very, very common. Now, sometimes people will want to not take the risk of loading those implants, meaning put the teeth directly onto the implants, and there's some risk. We've lessened that over the years, but there's some risk with that. So sometimes we'll keep several teeth and use those temporarily to support a temporary bridge as implants heal. Once the implants heal, then we can load them, rather than loading them on the day of placing them, if that makes sense.
So I take it that if somebody has a need for a total replacement, so to speak, you'd still prefer to do it sequentially than do it all at once?
I don't know if it's a preference. There's something to be said for doing it all at once, and it's done very successfully, and we know how to do it. We use digital radiography, obviously, digital planning. Everything is done on the computer so that when it comes time to placing the implants in the mouth, they are placed at the only position possible, which is the positions we planned on the computer. It eliminates surgical time. It makes the procedures go faster. It allows more precision and accuracy, makes the teeth fit on so much easier because it's all planned ahead of time. So there's something to be said for that, for sure,
Sure.
of just having it done 3 hours, had teeth beforehand, rotten teeth, unhealthy teeth, but had teeth, and now have better, nicer teeth on the way out 3 hours later.
Now,
So there's something to be said for that.
As I recall, is altogether 32 teeth?
Yes, there are 32 teeth in the mouth, but that includes wisdom teeth and
Okay.
and both jaws. Yeah.
You'll do that in about 3 hours.
So you can do one jaw, and typically you would do 14 teeth. One molar to one molar is
Right.
about 14 teeth, and it does not mean 14 implants.
Right.
It could mean 6 implants. It could mean 8 implants. Sometimes we do 4, although typically prefer more than that. But yes, that can be done with the teeth in 3 hours or so.
And then how challenging is it post-operatively for them to deal with your instructions to eat on one side?
You know, well, they don't have a good side to chew on
Right.
because it's a jaw, and
Right.
you can't say chew on one jaw and not the other jaw.
Right.
So then it's just a strict soft diet.
Yes.
And that becomes still noodles and fish. We instruct people that they can eat anything you can cut with a fork.
Okay.
And that gives them a good visual of, okay, if I could cut this with a fork, then I can eat it.
And ice cream may be a friend
Ice
during
cream
that
is the
period.
best. Who doesn't like ice cream?
There we go. There we go. What happens if patients wear an implant and it heals without a tooth?
Oh, so there's no tooth directly on it.
Right,
Okay. So people have in the back of the mouth, typically if it doesn't show, then they just have a space for a few months as the implant is healing.
Okay.
If it's in the front of the mouth, most people don't like to go around without a tooth. And so we have different ways that we can make them a temporary tooth. Sometimes they're fixed in place, meaning they're not to be removed. Most often they're removable, meaning you go out to a party, you put your temporary tooth in, and a lot of times it looks like an Invisalign tray, so it really doesn't look like anything at all. If anybody notices anything, it might just look like you're doing Invisalign, and it's not something that most people notice.
We have 30 seconds left. If our viewers have any questions, how can they reach you?
So the best way to reach me would be to go on our website. It's www.implantsdc.com, and they can call the office and email us any which way. We're always happy to answer any questions related to anything at all.
Terrific. Thanks for a wonderful interview.
Thank you.
My thanks to Dr. Puterman for a very informative interview about dental implants. My thanks to the team here at the studio, and most important, my thanks to you, the viewer, for inviting us into your home. You can reach me at the address posted on the bottom of the screenshot. If you have any questions or suggestions, feel free to reach out to me. As for my next show, it's my pleasure that Dr. Mahmoud Doski, a highly regarded primary care physician, will be discussing the challenges of practicing primary care in today's day and age. It's going to be an interesting show. See you then next time for another edition of Housecall. Good evening.